Hello again if you're coming from my introductory video about teething where I go through what are symptoms, what's normal symptoms versus what is atypical when you should seek the care from your pediatrician. If you want to watch that one though, you haven't actually watched it, I'll link it here in the cards for you. And now the teeth have arrived. What do we do to take care of them? Once the baby begins cutting teeth, be sure you're brushing them. You want to use a toothbrush with true bristles. Let me show you what I mean. So these toothbrushes are training toothbrushes, and they're not training like you're learning to brush teeth. They're training like you're trying to desensitize them to having something in their mouth. So you want to use these, the banana brush, the finger brushes, the silicone brushes before baby has teeth. You can start cleaning a baby's mouth. You know, they're 2 weeks old in the bathtub. Whenever they're taking a bath, you also can clean their mouth. Use a little training brush. You can also just use a washcloth. That's what I do because I'm cheap. And you just wrap your finger around that washcloth and wipe their gums. You're wiping their tongue every time they have a bath. Sometimes on the changing table, if you're not doing a bath every day, you just practice with them that they get their mouth cleaned every day. And that is going to help them get used to the idea once teeth come in of having their teeth brushed. And once teeth come in, let me show you what I want you to use. So the toothbrushes that I like have true nylon bristles, and there is a triple-sided brush. There are two that I link in my shop. Frida Baby has one. The bristles are a little bit shorter, and then Surround by Specialized Care Co. has another. You can see it just would cover the teeth on both sides, especially molars, but you can use it for front teeth. It just helps with brushing, especially when you have a difficult brusher. That is where that teething tool I showed you earlier, the brushing buddy, can come in handy because you can use this as the mouth prop, and then you can use this as the brush to clean those back teeth quickly and efficiently if you're having trouble with toothbrushing. There. And there. So that is great. Brushing buddy and a triple-sided toothbrush. When they have like their literal first two teeth, you can just use a simple toothbrush. You don't have to necessarily use a triple-sided toothbrush. These by Oral-B are my favorite. They have 0 to 3, Winnie the Poohs, a little bit bigger kids. I think this is 2 to 3, is Disney princesses and other characters, but Winnie the Pooh is the 0 to 3 age. That is the first toothbrush I recommend. The bristles on that one are a little bit shorter and a little bit softer head in case they're chewing on it. It is okay if they chew on that toothbrush, but once those bristles get kind of splayed or if any bristles start to come loose, you need to throw it out, get a new one. You want to change that toothbrush about every 3 months, or with season changes, if they get sick, get a new toothbrush. What about toothpaste? Yes, the American Academy of Pediatric Dentistry does recommend now since 2014 using fluoride toothpaste for children as soon as their first tooth arrives. The only caveat I would say is if they are an early bloomer, before 6 months of age, before they've started solid foods, talk to your pediatric dentist about whether or not you need to be using fluoride toothpaste. They may say only at nighttime just to lower that dose because baby is still so small and those teeth came in early. But for most kids, when that first tooth comes in around age 6 months, you do want to use fluoride toothpaste. They recommend a grain of rice size amount of fluoride toothpaste. I will show you a picture of what a grain of rice size amount of fluoride toothpaste looks like. An easy way to think about it is just the white part of your pinky fingernail. So just a little tiny amount, little piece of jasmine rice, that much fluoride toothpaste, and that picture should help too. That's how much you want to use in the morning and at night, so twice a day for brushing teeth. So you do not need training toothpaste. That is just a marketing ploy. Before the teeth come in, you can just use water. You don't need any type of toothpaste. And then after the teeth come in, you want a real toothpaste that has fluoride in it. Some of my favorite toothpaste brands are these. These tend to be what please most kiddos and they like them. Crest Sparkle Fun is the go-to. You can find it in a grocery store. It's really cheap. Sometimes kids say this is spicy. That is because of an ingredient called SLS, or sodium lauryl sulfate. And some people are just more sensitive to it. Even adults, if you get frequent mouth ulcers, it may be due to sensitivity to SLS, or if a kid says something is spicy, it's usually SLS if it's not minty. And so then if they're sensitive to SLS, or you just want a different fun flavor, these are fabulous. For sensitive kids that don't like flavor, you can try something flavorless. This is literally just sweet. It's called Dr. Bob. And then these, and all of these are linked in my shop under toothpaste and floss, themomanddentist.com/shop. This is Tanner's Tasty Paste, and this is Hello. Hello is an offshoot of Colgate. Both of these are SLS free, and they've got really fun flavors. This is Dragon Dazzle Blue Raspberry. They have chocolate, orange, and vanilla. The vanilla in Tanner's tastes like cake icing. It is so lovely. So these are some great pastes if you want to try a fun toothpaste for your kiddo, but you as an adult can use these too. In the US, the amount of fluoride in kids paste and adult paste is the same. It's 1100 ppm. So you do not have to use a grown-up toothpaste if you're a grown-up and you want to try the Tootsie Roll chocolate flavored Tanner's. Live your best life. A lot of parents though want to know, is fluoride safe for their baby? I've got another video on that. I will link that in the cards. But yes, in the dosages that we are giving, in a grain of rice size amount of fluoride toothpaste, there is about 0.05 milligrams of fluoride, which is very, very small. That's comparable to what dietarily they're going to get in their oatmeal. In formula, there is not very much. So in a day, 0.1 milligram. For comparison, in a liter of water that you or I might drink in a day, day with tap water, it's 0.7 milligrams. That is why I do say, caveat, little aside, don't mix infant formula because it already contains fluoride, 0.1 to 0.3 milligrams, not added, it's just in there. Don't mix it with fluoride water in the first 6 months of life, again, to minimize that amount of fluoride that they're getting, because fluoride, it does matter by dose. You don't want to give too much, but it is helpful in the right range. And so this small amount of fluoride toothpaste is good. If you're mixing formula, use fluoride-free water. That way they're only going to get a small amount of fluoride and not too much fluoride. Parents also worry because the child can't spit. Is it safe to use real toothpaste because the child can't spit? Yes, that's why we recommend that grain of rice size amount. We're assuming they are swallowing most of that toothpaste. And if you've got a little bit older child that's learning to spit, typically kids begin to get pretty good at it around age 3, and they really master it by age 6. Between age 3 and 6, you're switching to a pea-sized amount of fluoride toothpaste. They can spit out that toothpaste. I would not, though, have them rinse afterwards because, one, you're washing away that fluoride. That's the whole purpose of the toothpaste, is to get that fluoride on there. It needs to sit there for a little while. It takes time for it to work. You don't want to rinse it off right away. Same for you as a grown-up. Don't rinse with water after you brush your teeth. You can use fluoride mouthwash or just spit and leave that little film of toothpaste in there. If you're worried that they're swallowing too much, just have them stick their tongue out and you can wipe their tongue off with a washcloth, but don't have them rinse. I tell parents too, if they're not good at spitting and you have them rinse, they're just going to swallow more with the rinse. So no need to rinse, and we do expect the little ones to swallow it. That's why age 2 and under, or until they turn 3, use just a grain of rice size amount of fluoride toothpaste. I don't yet have it, but I'm going to work on a toothbrushing demo video showing you how to brush your little one's teeth. So wait for that, look for that. Let me know in the comments if you really want to see that one soon. If any of this info is helpful, be sure to hit that like and subscribe button, and go and find me over on TikTok and Instagram as well at The Mama Dentist. Now, are you wondering when to take baby for their first dental visit? I've got the answer, and it is actually in a video that I already made. So I will be sure to put that here, and you can follow that to see when the American Academy of Pediatric Dentistry recommends your child first see the dentist.